There is a pair of hands in modern medicine that many people have compared to the hands of God. But these are not human hands. One of the most advanced medical technologies ever created. A surgical robot. This is one of the greatest feats of mechanical engineering ever built on Earth. Peeling an eggshell without disturbing the yolk, stitching the skin of a grape, or sewing the surface of a single corn kernel with almost flawless precision. These aren't extraordinary challenges for this machine. They're simply routine demonstrations of its incredible capabilities. When people hear the word robot, they often imagine a machine standing in the operating room, performing surgery on its own and replacing the surgeon. But the reality is very different. A robot does not replace the surgeon. A robot does not make decisions. A robot does not perform surgery independently. So why are leading hospitals around the world investing millions of dollars to acquire these systems? What makes people call it the hand of God? I'm Dr. TienTran, an ENT specialist. Today, I'm going to perform a robotic-assisted ear surgery. And our story begins with a patient who believed he would need a hearing aid for the rest of his life. Mr. Hai, a 58-year-old man, had been gradually losing his hearing for years. He kept turning up the volume on his television. He frequently had to ask people to repeat themselves. Family conversations became increasingly difficult. Like many others, he began thinking about hearing aids. He assumed that age was slowly taking away his hearing. But after a specialized examination, doctors discovered something unexpected. The cause was a condition called otosclerosis. Fortunately, otosclerosis is often treatable with surgery. And what made his case even more remarkable was that the procedure was performed with robotic assistance. When patients first see a surgical robot in the operating room, they almost always ask the same question. Will the robot actually perform the surgery on me? The answer is no. The surgeon performs every step of the operation. The robot is simply an extension of the surgeon's hands. But it may be the most extraordinary extension medicine has ever created. Imagine trying to repair a highly sophisticated mechanical watch. Now imagine that the components are even smaller. That is the world of ear surgery. Some structures inside the ear measure only a few millimeters. Delicate nerves, tiny blood vessels, and the hearing mechanism itself are packed into an incredibly small space. Even the slightest movement can make a significant difference. This is where robotic technology demonstrates its true value. Advantage No. 1: hands that never tremble. No matter how skilled a surgeon may be, the human hand naturally has microscopic physiological tremors. We rarely notice them. But under high magnification during microsurgery, those tiny movements become very real. Robotic systems can filter out these tremors almost entirely. Large hand movements made by the surgeon are translated into extremely small, smooth, and stable movements at the instrument tip. It's like transforming a paintbrush into a precision engineering tool capable of drawing perfectly controlled lines. The surgeon's experience remains the most important factor. The robot simply allows that expertise to be delivered with unprecedented precision. Advantage No. 2: seeing what the naked eye cannot. One of the greatest strengths of robotic surgery lies in its imaging system. Instead of relying solely on direct vision, surgeons work with ultra-high-definition 3D visualization. Structures can be magnified up to 10 to 15 times. Tiny blood vessels, delicate nerves, complex anatomical structures. Everything appears in remarkable detail. What once required educated judgment based largely on experience can now be visualized with extraordinary clarity. The boundaries between tissues become easier to identify. Critical structures become easier to protect. And surgical precision reaches an entirely new level. Advantage No. 3: precision beyond human limitations. Imagine moving your hand 1 centimeter. A robotic system can scale that movement down to just a few millimeters or even less. This allows surgeons to perform incredibly delicate maneuvers within extremely confined spaces. That is why robotic technology has become particularly valuable in specialties where precision is critical, including otolaryngology, ENT, neurosurgery, urology, cardiac surgery, and many other advanced surgical fields. The goal is not to replace human skill. The goal is to enhance it. Why does a surgical robot cost millions of dollars? A modern robotic surgical system can cost more than $3 million US. And that is only the initial investment. Many of the instruments are designed with strict usage limits. After a predetermined number of procedures, the system requires those instruments to be replaced, even if they still appear to be in excellent condition. At first glance, this may seem expensive, yet hospitals around the world continue to invest in robotic surgery. Why? Because of what it can offer patients. For patients, the real question is not how much the robot costs. The real questions are, is the surgery safer? Will recovery be faster? Can complications be reduced? In many cases, the answer is yes, because robotic-assisted surgery often allows for greater surgical precision, smaller surgical access points, less damage to surrounding healthy tissue, reduced blood loss, shorter hospital stays, faster recovery, lower risk of certain complications. Every technological advancement serves one ultimate purpose: to improve patient outcomes. Several weeks after surgery, Mr. Harry returned for a follow-up visit. Smiling, he told us that the first thing he did when he got home was lower the volume on his television, so you can enjoy the World Cup to the fullest. For years, he had believed that hearing aids were his only future. But in the end, what changed his life was not a hearing aid. It was the combination of surgical expertise and cutting-edge technology. Over the decades, surgery has continued to evolve. From traditional open surgery, to the surgical microscope, to endoscopic techniques, and now robotic surgery. But they help surgeons see more clearly, operate more precisely, and perform procedures that were once considered extraordinarily difficult. Perhaps that is why some people call robotic systems the hand of God. But the true miracle is not the machine itself. The true miracle lies in the partnership between human intelligence, experience, and technological innovation. And that partnership may well represent the future of medicine. Thank you for being part of the Dr. TienTran community. Medicine is not just about treating diseases, it's about understanding them so we can protect our health every day. If you have any questions, leave them in the comments below. I'll be happy to answer them in future videos. I'm Dr. TienTran. Stay healthy, and I'll see you in next video.